the health system in general across the nation has been very reactive. We really can't find people until they show up at our doorstep, and oftentimes, unfortunately, they're showing up in crisis. A major challenge is turning that tide to be less reactive and more proactive. We have access to all kinds of data that we didn't have 10 to 20 years ago, and we have advanced statistical methods to be able to really analyze those data in a new way. And so rather than waiting for someone to be in crisis, we can get way ahead of the curve using these data to find people earlier. It does a lot for us. It really turns the way we deliver care on its head. That's really one of the things that we're trying to turn at Alliance. Alliance Behavioral Health is partnering with the Duke Child and Family Mental Health and Developmental Neuroscience Division to develop predictive analytics using Alliance Behavioral Health and Physical Health claims to identify youth, again, at risk for treatment in an out-of-home setting. These are kids who we know are going to present at the Duke Emergency Department maybe once, maybe several times. We're trying to identify these youth earlier to prevent that emergency department admission and also that sort of longer term, the treatment in an out-of-home setting. Through this partnership, we have learned a lot about how to work together around these data. At Alliance, we really know where these youth are being treated across the region, right? We know any hospital that they go into, any clinician who they see. Duke really only knows when they hit the Duke system, but they also see the individual face-to-face, which Alliance does not. And so combining those two really helps us understand on the ground what is really happening for this youth and their family and what is happening for them over time, and that can help us tailor our interventions to be really effective. And if this is someone who's not connected with the system that we're seeing, for example, is presenting to a lot of different emergency departments but doesn't have a behavioral health home or primary care home, we have many ways to reach out because we're working with Duke. We select out those members who are treated within the Duke system to work specifically with Duke. And we're piloting that and have had really good experiences, both from, again, the clinical perspective, but also the sort of health system perspective. We want to do that throughout the Alliance network. So we have another pilot going in Cumberland County where we're doing very similar things. We've got care coordinators at the table, we've got the medical staff, and we've got the community relations staff there. What we're really missing in Cumberland County is having the provider at the table. So that's really our next step, is to really reach out to providers and put this information about these at-risk youth in their hands, because again, they are the people who are meeting with this person face-to-face. They know the family trusts them. And so how can we, again, share our data and our regional presence and our care coordination with their clinical expertise on the ground to really maximize the benefit for our members.